If you're new to Medicare or reconsidering your coverage, understanding the critical differences between Medicare Advantage and Medicare Supplement plans will be the most important thing you do. Now, the good news is it is not nearly as complicated as it seems.
I'll believe that when I see it.
I'm Cameron Giardini from Giardini Medicare, and in the next 15 minutes or so, I'll break down everything you need to know about the two fundamental options as we tackle the seemingly never-ending Medicare Advantage versus Medicare Supplement debate. And we will also provide important 2025 updates regarding both of these options. If you want more answers to your specific Medicare questions, make sure you comment below, or you can also scan the QR code here on the screen to join our private Medicare Q&A Facebook group. Let's start with the foundation. Original Medicare is made up of Part A, often called hospital insurance, and Part B, medical insurance. You must be enrolled in both Part A and Part B to enroll in either Medicare Advantage or Medigap plans. While most beneficiaries qualify for premium-free Part A, the standard Part B premium for 2025 stands at $185 per month, though that can increase based on your previous income levels due to the income-related monthly adjustment amounts, or IRMAA, which we do break down in other videos. Real quick, take a moment to look at this visualization showing what you would pay out of pocket with just Original Medicare. Note, there is no ceiling or maximum out-of-pocket limit on these expenses.
Looks expensive.
After enrolling in Part A and Part B, assuming, like most people, you are not content with just Original Medicare and these charges, you'll face the famous decision: Medicare Advantage or Medigap.
You have to choose.
Let's explore Medigap plans first. Medicare supplements, also commonly called Medigap plans, they are offered by private insurance companies specifically to address the financial gaps left by Original Medicare coverage. Something very important to understand is that Medigap plans, they provide secondary coverage while Original Medicare remains your primary insurance. This arrangement gives you flexibility. You can visit any healthcare provider nationwide who accepts Original Medicare and also accepts new patients. This holds true regardless of the insurance company providing your Medigap policy. If a provider takes Original Medicare, they must accept your Medigap plan. With Original Medicare as your primary coverage, you will very rarely encounter prior authorization requirements, since coverage decisions, they come from Medicare itself and not the insurance company. Additionally, Medigap plans, they must cover all Medicare-approved treatments while having no obligation at the same time to cover services that Original Medicare does not cover. For a more comprehensive list of Medicare-covered services, visit Medicare.gov or download the What's Covered app on your smartphone. Services typically not covered by Original Medicare and therefore not covered by Medigap plans, they include routine dental, routine vision, hearing aids, and annual physical exams. However, some insurance companies providing Medigap plans, they may take exception to this and provide added coverage for these non-Medicare covered services. So as always, use the link in the description below to connect with us or another one of our independent broker partners to find unique, specific details for Medigap plans that are offered where you live. When selecting a Medigap plan, you will notice the standardized benefits organized by plan letter, which is A through N in most states.
It's also confusing, right?
It is so confusing.
While this chart from the Medicare and You Handbook, it might seem complex, we typically recommend narrowing your focus on the most popular Medigap options, which right now are Plan G, Plan N, and the high deductible version of the Plan G. What you pay for your Medigap plan will depend on the specific plan letter as well as your location. This means the state and even the zip code you live in. Other factors like your gender and age will also play a role. Here is a current map showing the average monthly premiums a 65-year-old might expect to pay for these 3 different Medigap plans in each state across the country. Similarly, here is a map for those same plan premiums for a 75-year-old in each of those states. This way, you can see how your age might impact your Medigap premiums. Medigap plans, they also can and will increase their premiums over time. It is very important that you expect yearly premium increases with Medigap plans. You can see here a graph showing the average increases over the past few years, and if you want to better understand why these increases happen, make sure you watch our other video you can see here on the screen. Medigap premiums, they are usually higher than those of Medicare Advantage plans, but Medigap plans, they provide comprehensive medical coverage in return. It is worth noting that current Medigap plans, they don't include prescription drug coverage, requiring separate enrollment in a Part D prescription drug plan from a private insurance company with its own additional premium. In 2025, this is about $45 per month on average, but this can range all the way from $0 to triple digits per month in premiums. It is also important to note that Part D coverage can and it will change yearly, so make sure you evaluate your options each year during the fall annual election period from October 15th to December 7th. Now that we have covered some of the common costs for original Medicare, Medigap, and Part D coverage, you can see on the screen the total monthly premiums a 65-year-old in a state like Tennessee might expect to pay per month for these coverage combinations, just as an example for you.
That doesn't sound too bad.
To illustrate how Medigap plans work in real-world situations, let's consider an outpatient total knee replacement at a surgical center. The provider submits the bill to Medicare Part B, which establishes the Medicare-approved amount. For this example, that would be $10,512. Medicare Part B then covers 80% of this approved amount as your primary insurance, with your Medigap plan covering all or most of the remaining 20%, again depending on your specific plan letter. Assuming you have a Plan G in this case, you would only be responsible for the annual Part B deductible if you have not already met it for the year. In 2025, this deductible is $257 for the calendar year. After satisfying this deductible, you would face no additional out-of-pocket costs for Medicare-covered services for the remainder of the calendar year. We cover how Plan N and the high deductible G work in more detail in other videos. A final feature of Medigap plans is that they are guaranteed renewable. Essentially, this means that your Medigap insurance company cannot cancel your policy or refuse to renew it each year, regardless of your health status or how many medical claims you have. As long as you continue to pay your Medigap premiums on time, you will keep your coverage. This makes your medical coverage from one year to the next extra consistent. Before we transition to Medicare Advantage plans, please take a moment to review the summary of Medigap's advantages and limitations as you can see here on the screen. Feel free to pause the video if you need to. Now let's shift our focus to Medicare Advantage plans, which represent a fundamentally different approach to Medicare coverage. Though they are often referred to as Part C, this is truly just for marketing purposes. Medicare Advantage plans, they are not a part of Original Medicare, nor are they provided by the federal government. Instead, they are private alternatives to Original Medicare, and they are offered by insurance companies who contract with Medicare.
Isn't that misleading?
They typically bundle Part A, Part B, and Part D coverage into one all-in-one bundled package. A key distinction: when you enroll in Medicare Advantage, it becomes your primary insurance. You'll rarely need your red, white, and blue Medicare card, so you can store it in a safe place. Your Medicare Advantage plan, it must provide all services covered by Original Medicare, except for hospice, though the delivery system for these covered services will operate quite differently than with Original Medicare and Medigap that we just talked about. Medicare Advantage plans, they typically utilize HMO or PPO networks with specific provider groups, which will vary from one insurance company to the next. Plans may require referrals for specialist visits, although this is seemingly less common than in the past. While some networks, they may be small and geographically limited, many plans do offer extensive national networks that provide greater flexibility than what many people commonly assume. However, they still do not offer the same provider flexibility as Medigap plans, regardless of what some may say. As an example, remember that even with PPO plans, out-of-network providers, they don't have to accept your Medicare Advantage plan or you as a patient, except in urgent or emergency situations. Because of these plan networks, Medicare Advantage generally functions similarly to employer-sponsored or individual health insurance you probably have now or have had in the past.
Seems reasonable.
An important aspect of how Medicare Advantage differs from original Medicare and Medigap coverage is prior authorization requirements. These plans often require your provider to obtain approval from the insurance company before certain services will be covered. Recent analysis shows approximately 1.8 prior authorization instances per enrollee annually, and this is according to data from KFF. Examples include requiring an X-ray before approving an MRI or CT scan, or maybe scrutinizing skilled nursing facility admissions. Prior authorization is particularly common for more expensive procedures, and you can even see here an example of a list of services that require prior authorization from an actual Medicare Advantage plan's documents. While many initial denials for prior authorization are ultimately overturned upon appeal, the process, it can be frustrating for consumers. When deciding whether or not Medicare Advantage is right for you, just make sure to consider the very real possibility of prior authorization without getting caught up in the fear-mongering you will almost certainly see on social media. Medicare does try to continually improve and introduce initiatives to streamline prior authorization requirements, but only time will tell for how effective these will be. As with Medigap coverage, your available Medicare Advantage options will highly depend on where you live. In some counties, you may find yourself in an urban area with as many as 80 plus Medicare Advantage plans available to you. Or you might be in a rural county with 0 Medicare Advantage plans available to you, even if you wanted one. According to current Medicare data, the national average premium for Medicare Advantage plans in 2025 is $17 per month, though in reality, the majority of plans are offered with a $0 monthly premium. You can see a map of the average Medicare Advantage premiums in each state, but keep in mind, even with a 0 premium plan, you are still responsible for paying your Part B premium with your Medicare Advantage plan. Since you might be wondering, these $0 premiums, they are possible because the federal government heavily subsidizes these private insurance companies to offer Medicare Advantage plans to transfer the risk to private insurance companies from the federal government. While Medicare Advantage premiums, they are attractive, these plans potentially involve higher out-of-pocket costs if your healthcare needs increase. For 2025, the maximum out-of-pocket limit for in-network services is $9,350 for the year, and this does not include prescription drug costs. However, most plans, they do set lower thresholds. Recent analysis shows the median maximum out-of-pocket limit for Medicare Advantage in 2025 is $5,400 for the year. Medicare Advantage enrollment has continued its upward trajectory, now representing approximately 54% of all Medicare beneficiaries. Beyond affordability, this growth stems largely from additional benefits offered by Medicare Advantage plans that are not covered by original Medicare. While you've likely seen these benefits heavily marketed, this chart highlights the most common supplemental benefits available through Medicare Advantage plans. As we have already mentioned, the Medicare Advantage experience differs substantially from Medigap, since again, original Medicare is no longer directly involved in your claims processing. Using our knee replacement example, you might pay a set copayment for outpatient surgery, perhaps a few $100s, and this could then be followed by additional copayments for specialist follow-ups or physical therapy. These expenses, they would all accumulate towards your annual out-of-pocket maximum, provided they are covered services. Finally, unlike Medigap plans, which maintain benefits from one year to the next, Medicare Advantage plans, they operate on yearly contracts. This allows the insurance companies to change the plan's cost, the benefits, and even the covered prescription drugs from one year to the next. They might even discontinue the plan entirely, so because of these potential changes, it is really important you review your Medicare Advantage options every year. Provider networks can even change anytime throughout the year, which is another good thing to know. We can almost guarantee that at least some aspect of your Medicare Advantage plan will change from one year to the next. Thankfully, this is made easier with an independent broker like ourselves. On the screen is a concise overview of Medicare Advantage pros and cons. Make sure to take a moment to review them by pausing the video. After evaluating both options, many people consider starting with Medicare Advantage while they're healthy, planning to switch to Medigap if their health deteriorates. Unfortunately, this strategy faces significant challenges, and if you can only take one thing from this video, we really hope it's this. When you first enroll in Medicare Part B at age 65 or older, you have a one-time 6-month Medigap open enrollment window that allows you to enroll in any Medigap plan that you're eligible for, regardless of your health and pre-existing conditions. After your initial 6-month Medigap open enrollment period ends, getting Medigap coverage, it usually requires passing medical underwriting in most states and situations. When this happens, Medigap insurance companies, they will review your current health as well as your health history and pre-existing conditions, and they can potentially deny your Medigap application or charge higher premiums. Acceptance is not guaranteed. A key exception to this, however, is guaranteed issue rights. These are special circumstances often tied to specific life events that give you a protected right to enroll in certain Medigap plans without going through medical underwriting. One notable example of guaranteed issue rights that will be particularly important to those of you watching this are the Medicare Advantage trial rights. For one of the trial rights, if you sign up for a Medicare Advantage plan when you first become eligible for Medicare, this means at age 65, you have 12 months to change your mind. Within that year, you can disenroll from the Medicare Advantage plan, return to original Medicare, and you have guaranteed issue rights to buy any Medigap policy that is sold in your state by any insurance company, and this is without facing medical underwriting, meaning no health questions. Lastly, although you may hear about states with Medigap birthday rules, just know that these unique rules, they are designed for people already enrolled in a Medigap plan, and it allows them to change to a new Medigap plan without health questions. But it is crucial to understand this does not apply to individuals currently enrolled in a Medicare Advantage plan trying to change to Medigap for the first time. When choosing your Medicare path, consider how each option would serve you in a worst-case scenario and think about it as a long-term decision. With Medicare Advantage, are you comfortable potentially navigating prior authorization and provider networks while paying up to your maximum out-of-pocket if you face a serious illness like cancer? And on the other hand, with Medigap, can you afford or manage these steadily increasing premiums, often 7% or more per year, in addition to these separate Part D costs? All of this in exchange for provider flexibility and comprehensive coverage, but also while foregoing many extra benefits. Only you can determine which approach aligns best with your healthcare priorities, financial situation, and risk tolerance.